Hi everyone, welcome to Chapter 8, Legal and Ethical Issues in Nursing, Informed Consent and Patient Self-Determination. So this is going to cover the area of autonomy that is so important when we talk about patient rights and patient care. And I know for some of you who work in pediatrics, you might think, oh, this is definitely harder because of with guardians and rights, but there is actually a pediatric portion to this later on down the lectures. So what is the role of consent? Informed consent is voluntary authorization by a patient or the patient's legal representative to do something to the patient. The key is patient comprehension. So consent becomes a legal concern because patients can sue for battery if the patient didn't consent per procedure and a treatment. They have to comprehend the risks and benefits of whatever the treatment is, and they have to also be able to be of sound mind to consent or of age. The right to consent and to refuse consent is based on the common law right of persons to be free from harmful or offensive touching of their bodies, and also the right to do what they want with their bodies. And consent is based on informed consent. And what informed consent means is that they truly understand what's going to happen to them. So I'm sure some of you guys have seen this where you get consent to hang from a patient to give them blood, and you read to them the risks and benefits from the piece of paper, and they sign it and you hang it, and you definitely are thinking, man, I bet you $1 million they don't understand what any of that means, like hemolytic reaction or high drops or anaphylaxis. So it's our job as nurses to make sure that the patient understands and understands what they're consenting for, and that's our job as advocates as well. So it's not even about liability, but ethically as advocates for patients, if you see somebody consenting to something and you're like, they don't get this, they don't understand this at all, it's our job to defend them. So patients need to understand that they are making an informed choice, and without informed consent, there's a potential of lawsuits for negligence. So if somebody, something bad happens during a procedure and they sue for negligence and it was one of the named risks, if the patient claims that their consent was not informed, you didn't tell me about these risks specifically, then you can be liable for negligence. So obviously documentation on that end is really important. So there's also something called informed refusal, and it's an important corollary to informed consent. So a patient must be fully informed of risks or complications that can occur if the patient doesn't consent to a recommendation. So for example, the idea against medical advice, a patient who leaves without being seen, a patient who refuses the blood transfusion. We see that all the time. Now listen, we have to respect people's beliefs, but they have to also verbalize that they truly understand what the informed refusal means. So if they're refusing their blood transfusion, they understand that they're at risk for hypoxia, death, heart attack, stroke. And oftentimes they have to sign something that explains that they understand what refusing it means, but despite that they want to refuse, and it's their right to do that. Inclusions in informed consent. So patients must receive the following in terms the patient can understand: brief but complete explanation of the treatment and procedure, names and qualifications of the persons performing the procedure, an explanation of any harm, pain, discomfort, and side effects during and after the procedure. So they need to know exactly what happens, they need to know who's doing it, and they need to know of any possible issue that can come with it. And that includes the pain and discomfort. So I don't know if any of you have ever witnessed this, but when somebody's getting like a bone marrow biopsy, and they say, okay, and you're going to feel some pressure in your hip. Now, nowadays, I think they're a little better about how they pre-medicate people for bone marrow biopsies. But I remember being on the unit and them saying to the patient, oh, it's going to be a little uncomfortable. We'll give you like, I don't even know, we'll give you 0.5 milligram of morphine or something. And then they drill this hole through their bone into their marrow. And they're like, okay, it's a little uncomfortable. And the patient's screaming, 10 out of 10 pain. Well, you're actually going to be liable for negligence as the provider or the nurse or whatever if you don't explain that actually it's going to be a lot of pain in your hip. Because that is also a considered side effect, even if it is transient. And also to be informed, patients must receive the following in terms that they can understand. So explanation of alternative therapies and the risk of doing nothing. So what are some alternative therapies? So for example, somebody needs to go to colonoscopy for screening for colon cancer. There are alternative therapies. And what are the risks and benefits of the alternative therapies? And then what's the risk of doing nothing? Explanation that patients can refuse all treatment or discontinue support. So making sure they know that they have a choice. They have the choice to refuse this. And then patients can still refuse treatment or therapy after it has begun. So at any time, they can stop the treatment. To be informed, patients must understand the information presented. So you have to document that you validated that they understood it. And so how are you going to do that for some people? Are you going to have them repeat it? Are they signing something? Are you sure that this patient can read? So if a patient can't read, and that's how you presented them the information and they signed it, you could get in trouble for that too. Do they speak English? If not, how did you consent them? Was it a certified interpreter, or did you use a family member? So it's really important that these things are considered when you're talking about getting consent. So forms of informed consent can vary. There's expressed consent, so expressing in some way that they consent to something. Implied consent. So, for example, when you take an online survey, that's implied consent. Written consent, that's when you sign something. Oral, when somebody verbalizes it. Complete consent and partial consent. So they might consent to a part of a procedure, but not another part of it. There's also something called emergency consent. Patients must not be able to make their wishes known. So if they're not verbal because they're intubated or they're unconscious, or a delay in providing care would result in the loss of life or limb, providers must have no reason to believe that consent would not be given were the patient able to deny consent. So if you can't get emergency consent if you're going to do something where like, you would think that somebody would double check themselves. Maybe they wouldn't want that. And also it has to be a true emergency. Standards of disclosure. So standards of disclosure ensure that patients are informed in their decisions and allow a means of determining the adequacy of the disclosure. So types of standards are physician-based standards, patient-based standards, and shared medical decision-making. So standards of disclosure ensure that the patients are informed in their decisions so they understand, they know everything that's going on, and allow a means of determining the adequacy of the disclosure. So they are able to make sure that they determined that they were told everything that's involved. Okay? So if you're going consent-based malpractice suits, okay, so the plaintiff is going to show the healthcare provider had a duty to know of the risk or alternative treatment. The healthcare provider had a duty to disclose the risk or alternative treatment, and that there was a breach of the duty to disclose. So what that means is, okay, so somebody sues me for consent-based malpractice suit. They have to show that I knew of the risks of the procedure and of the alternative treatments, that I disclosed it, and that there was, prove that I had a duty to disclose the risk or alternative treatment, and then prove that there was a breach of that duty. And it can be even as small as like leaving out a piece in your documentation, which is why in EMRs we have all these smart phrases for consents, and that's really important. The plaintiff also has to show if the reasonable patient standard is used, the plaintiff would not have consented to the treatment if he had known of the outstanding risk, and the undisclosed risk caused the harm, or the harm would not have occurred if an alternative treatment plan had been selected.